Good afternoon, everyone. The topic of this lecture is soft tissue considerations in implant-based maxillofacial reconstruction. The contents of the lecture are a rationale for implant support rehabilitation in reconstructed jaws, soft tissue problems in reconstructed jaws, classification of peri-implant soft tissues in reconstructed jaws, management of peri-implant soft tissues in reconstructed jaws, and I would end with a take-home message. Well, we all know that the rationale or the end goal of treatment of patients with large defects of the jaws has changed tremendously over the decades. In the 1950s to 1970s, perhaps it would have been disease control, where surgeons focused on controlling the disease and perhaps providing better survival rates to the patients. In the 1980s, with the advent of free flaps, restoration of form became a major goal or end goal of treatment. But however, right off late, it's been restoration of function and provision of quality of life for patients. And we know most patients come to us telling us that you've cured us and there's life after cancer. Can you please provide us good quality of life after your treatment? So how can we restore function and improve quality of life? We did a randomized control trial where we subjected 52 patients and randomized them into two groups. At the baseline, we found out what are their quality of life indices through an oral health impact profile and EORTC questionnaires. And patients was provided 2 implant-supported overdentures and 4 implant-supported overdentures and followed up for a period of 1 year. And we found that implant-supported dental rehabilitation significantly improved quality of life outcomes in reconstructed patients. Ever since, the literature is growing on these subjects, and there have been many authors who have done different types of studies but come up with nearly the same conclusion.